Your ecstasy, make myself a heaven from your fallen leaves, woven in the fabric of your time.
Welcome everyone to another wonderful episode here at Doctors of Podiatry. We have a very young patient who a couple of weeks ago presented to our office for the first time with a chief complaint of a crumbly, ugly toenail, which the patient has been battling for 9 long years. The patient has been implementing other treatments as well, not only now but also in the past. We won't really talk about those. The patient has been seeking a long-term solution to finally take care of this problem. Let's first talk about, the root cause at the core, the problem. This is a side view of the great toe. This is one bone, and then this is what we call the distal phalanx. A lot of times when we see, and I'll go ahead and present the case, when we see this clinical presentation of a dystrophic, thick, ugly toenail that's crumbly, that's basically kind of like, very, very soft, we like to get an x-ray, right? A side view x-ray to make sure that there's no, right? This is a bone spur, okay? And there's a lot of these patients that present with, again, this is the nail. We have the nail, the bone spur, and this is just to show you guys what the problem is. A lot of the times, the root cause is the little spur, okay? So we want to address the spur in order to address the clinical presentation, okay? So what I recommended to the patient, not only are we going to address the fungal element, but we're also going to address the bone spur. So my recommendation included, or will include, we make a tiny little incision here, okay? Using our minimally invasive techniques, we come here and we basically shave the bone spur down. And the reason why we do that is not only are we gonna remove the nail plate, but the nail has been basically pressing up against the bone spur and subsequently causing the nail to become ugly, crumbly, thick, and so on and so forth. So I hope I haven't really, confused anyone. This is very, very simple. Again, the patient has presented with something that a lot of people battle, fungus, and more than anything, the appearance. And once we see that appearance of the nail, that's exactly when we take the x-ray and we identify the problem at the core, which in this case is the bone spur, and then we make further recommendations. So it's going to be kind of like a 2-stage procedure. We're going to go ahead and remove the nail today. We're going to wait 2 weeks, and in 2 weeks we'll go ahead and shave the bone spur. And that's something that I think that Caesar and I, myself, we can definitely, maybe film that procedure. I think it's going to be a winner, absolutely. So without further ado, let's get to work. Okay, everyone, so as everyone can clearly see, the nail is very, very dystrophic. It's thick, it's ugly, it's basically, very, very soft. So I want everyone to take a look at the left, which is the good one. And let's bring them together like this, so everyone can clearly see the difference. We have a nice nail plate in comparison to the right. So what I'm gonna go ahead and do, and again, where is the bone spur? The bone spur is underneath the nail. So anytime that there is pressure or trauma, the nail is pressing down on the bone spur. And that can create something that's called nail trauma syndrome, subsequently causing the nail to become ugly, in simple terms. So what I like to do, the patient's toe is definitely numb. Kind of go like this. This is a really, really great technique. We call it the bottle cap technique. Excuse me there, Caesar. Thank you, sir. We come underneath like this. Okay. Kind of go like this, very carefully. Okay. This nail is very, very, everything is damaged. And I was definitely telling the patient, it's soft. you know, after so many years of having this, 9 years or 9 long years, the nail, you know, loses its integrity. Okay, excuse me there, Caesar. Thank you, sir. So we come underneath, right? We grab the nail just like that. And then, just so everyone can actually see here, we kind of go like this. And everyone, I want everyone to see something. What I mean it loses its integrity, you see? It's gonna, I know it's gonna definitely crumble. So we'll do this kind of like in little stages, kind of like this. And what I'll do now, just because now I know that the nail is very, very soft, I'm gonna come in through here a little bit. Go like this. Go like this. Like this, and help the nail detach so we don't cause any damage to the underlying nail bed. Okay. Okay, so now what I'll do is I'll come from the front instead. Okay, so we'll come right here and just start teasing it out, just like this. Something that's really difficult to get it all in one piece. There we go. There we go. And we need to definitely be very careful. We don't want to cause any damage to the underlying nail bed, because in 2 weeks, we will be performing this procedure. So we want to be very mindful. You see? So let's go ahead. We'll remove this part, okay? The nail bed looks very, very clean. And then we'll go ahead, grab this little piece here. Let's get into the nail fold here. Okay. Let's go ahead and detach it a little bit more. What happens with a nail, there's connective tissue that attaches, I'm just teasing it out, and that it attaches to the nail plate underneath. Okay. But we want to make sure that we don't pull on that connective tissue, because it can actually damage the nail bed. So we grab it here. And there it comes. And it's literally, it's like Play-Doh, the nail. See? Just crumbles everywhere. Grab a little bit more here. Bingo. Okay. And that's it. Okay. Very, very clean. So what are we looking at here? We're looking at the nail bed. What else am I looking at? I'm inspecting the nail bed to see if there's any trauma, any damage, because, you know, eventually the new nail plate will grow, right? Okay, we're all done. We're gonna go ahead and apply a little bit of antibiotic cream. We'll put the bandage. Of relevance and importance, right? You know, what do we do now? So number one, today we remove the nail plate. Number two, in 2 weeks, we're gonna go ahead and perform the minimally invasive procedure to shave the bone spur, which again at the core is the problem. It's a contributory factor to the clinical presentation. And then lastly, something that I discussed with the patient, which I like to do, you know, our job is to eradicate the problem. In this particular case, we did perform a nail biopsy. We did send a piece of the nail to the lab, and we did confirm the presence of fungus among us. So at that point, then we'll go ahead and pulse dose, give the patient a little bit of the oral terbinafine, okay, the Lamisil, which is a great medication for all intents and purposes. And we're gonna go ahead and do that for a little bit as well. And you know, we'll definitely implement the fungal eradication program. Okay, and in doing all of that, we will definitely improve, right? We're not magicians. We will improve the clinical presentation. I'd like to take this opportunity to thank the patient for allowing us to film this video. I'd like to take this opportunity to thank Caesar the Great, as always, for doing what he does best. And we will continue to do what we do, which is to educate the world 1 foot and 1 toe at a time. As always, thank you for watching.